Ebola is not a local outbreak in St. Lucia, but health officials say the country cannot afford to wait for a case before testing its systems, training key personnel, and strengthening the response network around hospitals and ports of entry. The renewed focus comes after the World Health Organization declared the Ebola outbreak affecting the Democratic Republic of Congo and Uganda a public health emergency of international concern on May 17th. At the time of the ministry's update, the Democratic Republic of Congo has confirmed more than 1,000 cases and lost hundreds of lives, with some patients now in isolation. Uganda has confirmed 20 cases and 2 deaths, and the outbreak has reached Europe. France confirmed an imported case following an earlier incident in which a U.S. citizen was evacuated to Germany for treatment.
The declaration of a public health emergency of international concern underscores the need for heightened international and regional vigilance and coordination, especially given the current situation in conflict-affected regions with limited access to healthcare services. Although at present, this event is not classified as a pandemic, coordinated international action is required.
According to the Caribbean Public Health Agency, CARPHA, the current risk to the Caribbean remains low. However, the St. Lucia Ministry of Health, Wellness and Nutrition says the island's high level of regional and international travel means public health systems must be prepared to identify and manage any potential threat at an early stage.
The Chief Medical Officer, the National Epidemiologist, and the Laboratory Director attended CARPHA's Joint Regional Health Security and Regional Coordinating Mechanism for Health Security meeting in Trinidad and Tobago from June 9th to 11th, 2026. This meeting served to advance regional coordination and collaboration for emergency response and prevention, preparedness and response, surveillance, and data sharing. The effective regional health coordination requires a coordinated, collaborative approach among member states and partners to protect the health of their local and visitor populations and mitigate health threats such as infectious diseases and pandemics.
Locally, the St. Lucia Ministry of Health, Wellness and Nutrition says it continues to update and strengthen the country's Ebola preparedness plans in partnership with hospitals and key agencies. Officials say the goal is to identify possible exposure early, report it quickly, and manage any risk before it becomes a wider public health concern.
The Ministry of Health, Wellness and Nutrition continues to strengthen the national Ebola plans in collaboration with the hospitals and health stakeholders. Sensitization and training have been held with healthcare workers, education, tourism, the business sector, immigration, customs, and SLASPA. Interventions continue to strengthen the ports of entry to support timely identification, reporting, and management of travelers who may have been exposed to Ebola virus disease or traveled from affected countries within the previous 21 days. The CARPHA Regional Referral Lab has now received the capacity to test for Ebola viruses and has coordinated transportation of suspected case specimens on behalf of member states. As per travel advisory for St. Lucia, the public is advised against travel to high-risk regions, and persons who travel into country from the defined high-risk regions will be placed on 21-day home quarantine. A 15-room isolation ward and a 12-bed management ward has been identified in the event cases are suspected, diagnosed, or detected on island.
Though St. Lucia has not reported any local Ebola cases, health officials say the ministry will continue monitoring the situation and reinforcing preparedness measures in collaboration with regional partners. The message from health officials is preparedness, not panic, as the country fortifies its systems before any possible threats reaches its shores. I'm Christabel Obi reporting for Hot 7 TV News.